The Competition Commission presented the findings of the health market inquiry last week. The 4-year-long investigation into competition within the private healthcare market found a lack of fair competition in the sector. Advanced Health in a smaller group in the industry, and we are now joined by the CEO Carl Grillenberger, who believes that this will create a more equitable landscape. Carl, many thanks for making time to speak to us. A fascinating stat here that I stumbled upon, at least from the findings. 14% of surgical procedures are actually taken in hospitals, and this could actually be taken up to 70%. Baffling statistics indeed. Do you get the sense that, yes, the government needs to do more, at least to lobby people to move to the private hospitals?
Thank you. Are you waiting for me to get on the line on
Yes, Carl.
air?
You are actually live right
Okay.
now. You could just carry on.
Okay, thank you so much. No, thank you for inviting Advanced Health and the Day Hospital Association to talk to you about the report from the Health Market Inquiry. I would like to mention one thing, that I'm extremely impressed with the report. This is absolutely a well-documented report, extremely well-researched, and it actually touches on everything that South Africans need to look at when it comes to the private healthcare industry in this country. We as the day hospitals are very much in support of the report, seeing that in the past we have actually been sort of prevented from competing in this market, although our prices that we offer are better than the prices offered by competing private hospitals. Medical practitioners have in the past been held back to do these procedures in day surgery facilities because it's expected from them to fill their lists in these hospitals. And if they can't fill these lists in the hospital is just putting pressure on these doctors and saying to them, listen, we are in the industry where we got to compete, although we are not price effective. Now, this report is leveling the playing fields, is motivating players in the industry to come forward and to really offer healthcare at a much better cost, at a much better price, and also considered about quality. Now, this is exactly what we were striving for and looking for as we go forward.
But Carl, how long do you anticipate it will take to stage an entire turnaround of the industry? I mean, some scary statistics, the fact that a healthcare provider, Discovery, for example, owns 55% of market share, and then your major private hospitals, your Mediclinics and your Netcare own about 80% of market share. How easy will it be for this to be turned around and to really level the playing field, as you say?
Thank you. I do believe it can be turned around, but it will take time. And we've already seen that the Health Market Inquiry took 4 years to get its report into the open. And also the report states that they are allowing for a further 5 years for the implementation of the changes that they are recommending. So in all respect, we got to accept that these things will take time, but we as an industry, we will try as far as practically possible to help the market inquiry to fast track some of the aspects of the report. I believe there is opportunity to address certain things on a quicker basis, and I believe that we could see changes as from the beginning of 2019, which will definitely be aimed at being to the advantage of consumers.
Carl, you do mention that maybe it's time to push the envelope here, maybe issue a moratorium to have more licenses granted out there. Do you get the sense that if more supply in terms of healthcare facilities is churned into the market, this might actually turn the tide?
I think you're 100% right. The day hospitals need additional number of providers in this marketplace. And this is one of the aspects that we've actually in the past discussed with the different provincial departments of health, and there was always a reluctance to issue new licenses. And the Competition Commission is also concerned that there have in fact been too many hospital beds that have been licensed and not enough alternative service providers. So we believe that this will open the field, that I don't think we'll see many more hospitals being built in the next few years, but the opportunity for day facilities is definitely there to actually develop. And the other encouraging side of that report is that they actually wouldn't like to see any of these new licenses to be granted to the largest 3 hospital groups, because they want independent players in this industry to make a difference and to actually grant something that is an advantage that everybody will benefit from.
Just a final thought from you, Carl. Are you not worried by some pushback that might come from some of the bigger industry players? We do know from weekend reports that they are not happy at all about some of the findings that have come out. So I'm wondering about some of the pushback you may anticipate during the implementation of those recommendations.
I think some of the larger players cannot just carry on and structure their systems the way they've done in the past. The systems in the past have been implemented on a basis that they added additional costs each year. They fragmented costs. They had the fee-for-service system, which was in place very long. And these are systems that are not conducive to cost-effective healthcare. I personally spent 2 years of my life in Australia where we had to deal with these systems on a fixed fee price. If a patient comes and says, I want to have this and this done, how much will it cost? In Australia, you must be able to tell the patient how much it is. In South Africa, the hospital will say to the patient, oh, we first got to see how long it takes in theatre. We got to see how much medication is involved. So the environment here has definitely not moved to be patient friendly. And I believe the changes that we will see in even the shorter new term future is that the system will be much more patient orientated and patient friendly. And if we look at the competition's main sort of emphasis was continuously the patient must get a fair deal. And I think that is what we totally support, and I think that is what the private hospital industry in South Africa will have to take into consideration and will plan and involve for the future.